Hello everyone, in the part 2 session of the NEET PG important questions. Before going into the questions, just make sure that you just go through the scalp, face and temple topic of the anatomy, because in this video we will particularly discuss about the questions of the scalp, face and temple topic. You can even watch my separate videos of the scalp and the face in my channel itself. Now first of all, the scalp is basically made up of 5 layers. And over here the 5 layers are going from outside to inside. Remember the mnemonics: scalp, that is SCALP. S for skin, C for connective tissue, A that means the gallia aponeurotica, L means the loose areolar tissue, and P is the pericranium. So these are the 5 layers of the scalp. Next is the scalp is the commonest site for the sebaceous cyst. What is epicranial aponeurosis? Now this is actually the aponeurosis formed by the occipitofrontalis muscle and correspond to the deep fascia. Occipitofrontalis muscle is basically supplied by the facial nerve. Surgical scalp is made up of, remember the 3 layers, the outer 3 layers, that is the skin, connective tissue and the epicranial aponeurosis, or we can say the gallia aponeurotica. A dangerous layer of the scalp is the loose areolar tissue layer. Now how does black eye occurs? Now over here, when head is basically blown by a tight punch, swelling occurs at the forehead, and then from the forehead the blood basically tracks down to the root of the nose and the eyelids, causing the black eye. Now the arteries supplying the scalp in the front of auricle are the 3 basic arteries, that is the supratrochlear, supraorbital and the superficial temporal arteries. Arteries supplying the scalp in back of the auricle are the posterior auricular and the occipital arteries. Now next is the branches of the external carotid artery on the scalp are the occipital, superficial temporal and the posterior auricular arteries. Now next, the nerves supplying the scalp anterior to the auricle are the supratrochlear, supraorbital and the auriculotemporal nerves. Nerves supplying the scalp posterior to the auricle are lesser occipital, greater occipital and the greater auricular nerve. I have discussed about all this nerve supply and the artery supply of the scalp in my particular scalp video. So make sure that you just watch them so you can easily able to remember them with the diagrams I have shown in my particular video. Now next is the temporal lines are basically present on the parietal bone. Motor supply of the scalp is temporal and the posterior auricular branch of the facial nerve. Lymphatic drainage of the scalp is the pre-auricular, post-auricular, or we can say posterior auricular and the occipital lymph nodes. Superficial surface of the temporal fascia is related to the superficial temporal vessels, auriculotemporal nerve and the temporal branch of the facial nerve. Features of the temporal fascia. These are, first of all, remember temporal fascia is the thickest fascia of the body and morphologically it represents the bone and it is used for the tympanoplasty. Muscles of the face are derived from the second brachial arch. Which cranial nerve supplies the facial muscles? 7th cranial nerve, that is the facial nerve. Muscles of facial expression lies in the superficial fascia. Now modulus of the angle of mouth is made up of the levator anguli oris muscle, zygomaticus major, buccinator, depressor anguli oris and the risorius muscle. Muscle of the anger are dilator nares and the depressor septi. Now, I have made one separate video on the facial expression muscles. So just watch that and you will be easily able to remember all the facial expression muscles. Now which muscles are responsible for frowning? These are the procerus, corrugator, supercilii. Surprise or the horror is actually expressed by the frontalis muscle. Muscle responsible for the laughing is the zygomaticus major muscle. Muscle responsible for doubt expression, it is the mentalis muscle. Worry is actually expressed by the orbicularis oculi muscle. Platysma is basically supplied by the cervical branch of facial nerve. Lower part of the orbicularis oculi is supplied by the zygomatic branch of the facial nerve. Upper part of the orbicularis oculi frontalis, corrugator supercilii are supplied by the temporal branch of the facial nerve. Risorius, depressor anguli oris, depressor labii inferioris, and the mentalis muscle are supplied by the marginal mandibular branch of the facial nerve. Orbicularis oris and the buccinator are supplied by the lower buccal branch of the facial nerve. Zygomaticus major and the zygomaticus minor are supplied by the upper buccal branch of the facial nerve. Now what actually happens in the Bell's palsy? Now the Bell's palsy, remember, that is ipsilateral, complete half of the face is paralyzed. Now what happens in the supranuclear facial nerve palsy? Now over here there is contralateral, lower half of the face is paralyzed. What happens in the central or the nuclear facial nerve palsy? Now over here there is ipsilateral, lower half of the face is paralyzed. Which is the sensory nerve of face? It is the trigeminal nerve. Angle of jaw is supplied by the C2 and C3. Branches from the ophthalmic division of the trigeminal nerve on the face are the supraorbital, supratrochlear, infratrochlear, external nasal, and the lacrimal nerve. Now the branches from the maxillary division of the trigeminal nerve on the face are the infraorbital, zygomaticofacial, zygomaticotemporal nerves. Branches from the mandibular division of the trigeminal nerve on the face are buccal branch, auriculotemporal nerve, and the mental nerve. Marginal mandibular nerve is actually a branch of the facial nerve. Mucosa and the skin over the buccinator muscle is actually supplied by the mandibular nerve. So over here, remember, the buccinator muscle is supplied by the facial nerve, while the mucosa and the skin over this particular buccinator muscle is supplied by the mandibular nerve. What is trigeminal neuralgia? Now this trigeminal neuralgia is also known as the tic doulorex, and it is basically sudden attack of pain in the distribution of the trigeminal nerve, and it mostly affects the maxillary division. What is transfacial artery? Transfacial artery is actually a branch of the superficial temporal artery, and it emerges through the parotid gland and is accompanied by the buccal nerve. Facial vein is basically formed by the union of the supraorbital and the supratrochlear vein. Common facial vein is formed by the facial vein basically joins to the anterior division of the retromandibular vein and forms the common facial vein. Common facial vein drains into the internal jugular vein. Now the retromandibular vein is formed by the union of the maxillary and the superficial temporal veins and formed in the parotid gland. External jugular vein is formed by the posterior division of the retromandibular vein joins to the posterior auricular vein to form the external jugular vein. Dangerous area of the face is the upper lip and the lower half of the nose. Lymphatics from the lateral forehead and the lateral half of the eyelids drains into the preauricular lymph node. Lymphatics from the central forehead, medial half of the eyelids, and the nose drains into the submandibular lymph nodes. Lymphatics from the central part of the lower lip and the chin drains into the submental lymph node. Eyelashes are seen in, remember, the lateral 5th, 6th part. Origin of the nasolacrimal duct is the ectodermal origin. I have made a separate video on the nasolacrimal apparatus, so you can watch that and just understand the whole nasolacrimal apparatus. What are the Meibomian glands? Now these Meibomian glands are actually modified sebaceous glands, and they secrete the oily fluid to decrease the evaporation of the tears. They are basically located in the deep surface of the tarsal plate, so they are also known as the tarsal glands. They are basically arranged in one row. Over here the ducts basically open behind the eyelashes. Now what is the gland of Zis? The gland of Zis is actually modified sebaceous gland. What is gland of Mole? Gland of Mole is the modified sweat gland. Nictitating membrane in human eye is represented by the plica semilunaris. Which vein drains from palpebral conjunctiva? It is the facial vein. Which vein drains from the bulbar conjunctiva? It is the ophthalmic vein. Conjunctiva is supplied by which artery? It is the ophthalmic artery. Superior palpebral conjunctiva is supplied by which nerve? It is the ophthalmic nerve. Ocular conjunctiva is supplied by which nerve? It is the ophthalmic nerve. Inferior palpebral conjunctiva is supplied by which nerve? It is the maxillary nerve. What is lacrimal gland? Lacrimal gland is actually a J-shaped serous gland and has large orbital and small palpebral part, and it has about a dozen of ducts. Orbital and the palpebral parts of the lacrimal gland are separated by levator palpebrae superioris muscle. What are accessory lacrimal gland? It is small serous gland beneath the palpebral conjunctiva, and it is about 36 in the upper and 6 to 8 in the lower lid. They are also known as the gland of Cross. Lower lips get sensory supply by the mental nerve. Now next is about the pre-ganglionic secretomotor supply for the lacrimal gland. So over here this basically passes from the, first of all, in the pons, from the lacrimatory nucleus in the pons, then it passes to the nervus intermedius, okay, then to the geniculate ganglion, and then to the greater petrosal nerve, okay, and then it basically passes to the nerve of the pterygoid canal, and then finally relays into the pterygopalatine ganglion. Now next is about the post-ganglionic secretomotor supply for the lacrimal gland. So where we stopped previously in the pre-ganglionic secretomotor supply, we stopped over here in the pterygopalatine ganglion. So continue from over here only, that first of all pterygopalatine ganglion, then it will pass to the maxillary nerve, okay, maxillary nerve, then the zygomatic nerve or zygomatic branch, then to the zygomatic-temporal nerve, then the lacrimal nerve, and then finally to the lacrimal gland. So let's revise again from the beginning. First of all, at the lacrimatory nucleus of the pons, then it passes to the nervus intermedius, then it will pass to the this geniculate ganglion, then it will pass to the greater petrosal nerve, then the nerve of pterygoid canal, then it will relay into the pterygopalatine ganglion. Then from over here, this ganglion, this particular supply will actually go on to the maxillary nerve, then to the zygomatic nerve, then zygomatic-temporal nerve, then lacrimal nerve and the lacrimal gland. Just remember this easy diagram, you get easily able to remember the whole supply. So today up till here we will discuss about the further questions in our further videos. Thank you so much.